Tell me who you are, because nobody knows right now.
Yes, I'm Dr. Mohsen Kazemi. I'm a chiropractor with a specialty in sports and a specialty in rehabilitation and acupuncture. And I won my master's degrees in professional chiropractic practice. I'm an associate professor at Chiropractic College, and I run the sports residency program there, and been using shockwave therapy since 2003.
So basically, you don't sleep, is what you're telling everybody.
Not really. I have a good sleep.
You have the shockwave from Magnatech.
Yes.
And you chose it for certain reasons. Can you just tell me a little bit about what you do with it and why you chose it?
The reason that I chose this special brand, which is the Dollar Cast, is the fact that most of the studies, clinical study has been done using this machine for the radial shockwave. This is a radial shockwave. There's a difference between radial shockwaves and focused shockwaves because of the way that the waves propagates. In radial shockwave, the wave goes this way. In the focus one, it goes this way. With the focus, you usually need an anesthetic, which make it harder for everybody, like a physio or a chiropractor, to use that. Whereas this does not require any anesthetic. The price was cheaper than the focus shockwave, which at that time that I started, they were up from $300,000 to $500,000. So it wasn't something that you can acquire easily. So that was the reason that I used this. I bought this.
Did you look into any other claims? There were some imitation machines, or there were some machines that claimed to do similar things?
Tell you the truth, at the time that I got this one, there was no others. This was it. It was initial. That was the main one that was built. So at that time, there was not much of a competitor, especially in Canada. So
okay.
that wasn't a really issue.
So long and short is, it was still expensive for a small clinic in that respect, but what did it do for you as a business person? But don't forget to tell me what it did for the patients, and how does the two fit? Because it's expensive. Is it worth it, right?
Yes. I tell you something about me. I didn't think about business. I thought about how I can heal my patients. So I didn't go to buy it as a business. As a business, it wasn't that good initially because I didn't know. I was almost the first chiro who had it in Toronto, and it was a lot of work to let people know what it is, how it works, and all that. So initially, I bought it. I got interested in it because of what it does. So with the tendinopathies, that you've done all the stuff and nothing respond before you send them to surgery, shockwave therapy has been shown to be a choice treatment at this point in time. So, for example, for plantar fasciitis or patellotendinopathy, Achilles tendonitis with calcification, calcific tendinosis of the rotator cuff, those kind of things. At that time, it was like, what can you do for it? You either send them for surgery if they don't respond to conservative treatment, which is chiropractic, acupuncture, physio, all of that. And at that point, shockwave therapy has been very, very promising. Most of the study now, what we see is that 70 to 80% total resolution after 3 or 4 treatments. When we got this, it was quite expensive. The treatment was very expensive. In Canada, we could give it much cheaper than the States. So I had a number of people from the States just coming in for the therapy. The machine was much more expensive than it is now, so hence the treatment was more expensive as well.
Yeah. And what are the patient's reaction, and how simple is it to set up?
The machine is very simple to work with. You just have to know where and how to use it. Usually the handle is used perpendicular to the most tender area, and we have a study that's been shown and compared the utilization of the machine using the most tender point upon palpation versus utilization of machine using diagnostic ultrasound, finding the lesion and applying it there. What they found out is that the one that was done with the tender point shown a better result statistically. So we know that the palpation probably is even better than just going through the diagnostic ultrasound and use it. So very easy. You do your diagnostic procedure, examination, all of that. You come with the diagnosis. You find the place that you need to use it. and you apply the machine perpendicularly right to that area using gels and all that. And then usually the usual protocol is 2,000 to 2,500 hits at about, and it depends. You can go from 3 or 4 hertz to about 10 hertz, 12 hertz, and that would take you somewhere between 10 minutes to 15 minutes to finish a protocol.
That's a treatment now, right? And how many times do you see the patient? What's the comments you get? Do patients freak out that they need painkiller or they need to be put down because the pain is through the roof?
We do not do that with this with the radial because the pain is not as much as the focus. And apparently, a couple of studies has been shown when you use anesthetic, it actually decreases the effect. So that's another idea with the radial shockwave. You do not need to really go and do anesthetic. You would tell them, though, it is painful. It is a painful procedure. It's like, and I always tell them, it's like getting a hammer and hammering to the area, and that's exactly what it is. Initially, then you have different ways to decrease that pain initially, so to get them used to. But what we know is that after about 500 to 700 hits, anesthesia sets in. That's what we call hyperstimulation anesthesia. So the pain decreases. It's not going to be as bad. And you can also decrease the energy that you put in initially, so get them slowly there, and then you can increase it to go on. So there's lots of different ways. But you always want to tell the patient, yes, it's going to be painful, but every single one of them that I have done on this procedure on, when I warned them about it, they were okay with it.
Literally?
I have to take my time, slowly go back. Some of them gone through it. They said, you know what, I've had this problem for 10 years. If something going to take me out of it, I'll take the pain. And most of them they did, and they were happy after 3 to 4 treatments because now they can walk, they can move their arms, all of that, so they were very happy.
Okay, so you're helping them after 3 to 4 treatments,
yeah.
And then you never see them again ever?
Usually I will have them to come back about 6 weeks after the last treatment. What the research shows us is that the best result of the shockwave therapy has been shown about 8 to 12 weeks after. You will get the best results. So because the healing process that has been introduced, it will be completed at that time. So although you may not have pain relief right after the third one, but that 6 to 8 weeks after, you will see improvement, still improvement. Now, if they don't improve that much that you wanted to, so I like to see at least 80% better. And all
What'd you say?
80% better. Yeah. But if I don't see it, I may do one or two more sessions with them. So that all depends how it goes with that. But usually I see them at that point. Meanwhile, I'll give them the exercises and all the stuff that they need to do. And this is their responsibility to do that. I may have to go back and try to see how things are from there and go from there.
Now, important question. Please tell me you treated more than 3 or 4 people. I'm giving you a hard time.
Yeah, a little bit more. Yeah, a little bit more. I have had patients coming from England, a lot of them from the States, a patient from Mexico coming in getting treated. So a number of people from all over the world.
Is it in the hundreds, you think?
Maybe, yeah.
Yeah?
Yeah.
Okay.
Could be.
Could you do just a quick demonstration? Just on the palm of your hand?
Yeah. So the machine has a compressor, and the foot stands would be over here. So that one right there. So you turn the machine on. You need to validation. It sets up how many thousands of hits you want to do. Definitely this is very important because you want to make sure that it is about 2.5 bars. That's your energy that goes through the patient. Usually 2.5 bar is the set. And then definitely you don't want to go one at a time, so you put it at a multiple application. If this can go up to 5, and then this is your frequency, hertz, how many times you would do. Then you have to apply, and I have to get the, we have to put the gels, is over there. We need to put the gels on, and then from there go from there. So what it is you put the gel on. I assume that you put the gel. It's right there, right on the shelf. And I'm going to just do that. I'm going to just show you the tennis elbow. Thank you. So for the tennis elbow, you find the most tender points. You apply the gel. It would be better if I do it on somebody else. But anyway, the applicator would be perpendicular to the area. and then you press on that. Okay, I got to validate that. Here we go.
That's
Just
it.
like that. Yeah.
I see the countdown working.
So it goes all the way.
You don't have to do
down.
the whole treatment. I just wanted a quick
Yeah.
demo.
So that's how it works for the area. Yeah.
Okay. I'll just get you some paper towel quickly.
Yep. Thank you, sir.
Any other things you can add that we didn't cover? You covered it so thoroughly. I appreciate that.
Yeah, I think that's the whole thing of that about this.
Okay.
Not much more. That's all it is. And it's, your patient, I think, would appreciate you because after 10 years of having discomfort, now they can move. I have a number of examples of that. I have people, a gentleman from in his 60s actually, and he loved walking, but he had calcific tendinosis of bilateral Achilles, and he couldn't walk. He was from England. He came in, he heard about us. I think what he heard was that I had a patient who was in his 60s, he just turned 60, and he enrolled to do Arctic walk. Arctic walk is 350 kilometer walk in the Arctic. You go from there to the pole, and you come back. Very hard way of doing it.
It's not the same as walking on the beach in Miami, is it?
It could be, but 350 kilometers of that. So he wanted to go for that, but he had the problem with his plantar fascia, all the stuff. So I treated him, and he went and he actually did it. He was a world-renowned motivational speaker, writer. So he calls me and said, Dr. Kazemi, I thank you, and I send you an email, check out the link. So, okay, I didn't, I forgot. And then I was starting getting calls and emails with regards to getting treated, and I'm saying, where did you see us? I said, we see you on YouTube. What YouTube? And then I went, this gentleman who went and put 5 minutes of YouTube on how I helped him to get there. So it was very interesting. So this YouTube was one of the things that really everybody saw it. So, but interestingly is that you enable them to go and do what they need to do. One of my patients, his name is Stéphane Denis, just wrote a book on Gobi runner. Gobi is a desert in China. This is a 250K run through the desert in 6 days. With a backpack of almost 30 kilograms on your back. So you do 1 marathon a day in the desert, and the last day you do 2 marathons. And he also wanted to do that. He has lots of problems with his Achilles as well as others. And we treated him, and he just left actually 2 weeks ago for running the Sahara in Egypt, and he dropped me his book. So he wrote in there how he helped him and all that. So it's a very good. The whole thing is that you will be able to help your patient.
So is it fair to say that, I mean, you gave a couple of wonderful extreme cases. Mm-hmm. What about Mrs. Smith and Mr. Jones, who work at the 16th floor, the 60th floor of the Scotia Tower, and other? Is it you only athletes you treat, or what?
No, I actually you brought this. Initially, and there was a lady who was office worker, could not stand on her foot for two minutes. Bilateral plantar fasciosis, and so I told her, we can do this, and she said, you know what, I have done everything, nothing helped, I will go for it. So we did, I remember I did 2 treatments, 2 weeks. The third treatment, finished it, no pain. He could stand the whole day now, almost about 7-8 hours. Then she feels she's very good, and I told her, I said, don't do something that you haven't done before, don't kill yourself. But she didn't listen. She went to Caravana and danced 12 hours. Monday morning she was here with more pain. We did 1 more set, and then that was it. She was gone, could stand the whole day without any problem.
Great.